Do we have a quorum? Great. So we will call together the meeting of the Incarceration Prevention and Reduction Task Force Crisis Stabilization Center Committee. And with us today are Jack Hovenier, Doug Chadwick, Stephen Gockley, Michael McCauley, Ann Deacon, and Jill Nixon. And there's a land acknowledgement statement. And if I could actually read it, I will do so. Sorry. I just got my eyes checked yesterday, so didn't get the new glasses yet. So before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. So, first on the agenda is the impacts of House Bill 1310 on Crisis Stabilization Center operations. This is brought up because we have been talking about getting this new facility, the mental health side, certified for involuntary treatment under the criminal code, that 1031-110. And that allows a peace officer, a police law enforcement, to place a hold of up to 12 hours on someone, place them in a crisis stabilization center in lieu of arrest. And during that time, a mental health evaluation must be completed to determine next steps. Part of that process requires getting somebody from wherever police first encounter them to the Crisis Stabilization Center. And as we know, with some of our discussions about the new legislation that has been very confusing for the entire state, law enforcement doesn't really have the authority to just transport someone who may not be posing a harm to self or others or engaged in a crime. Now, 1031-110 does refer to encountering somebody who is apparently involved in a low-level crime. So I guess, Doug, I'm going to look to you in terms of how you've been talking about this particular very specific piece of another RCW. And is it possible to transport someone who is apparently engaged in a crime and divert them to the Crisis Stabilization Center and actually transport them there?
Sure. Obviously.
Sorry.
That is a very creative ringtone.
Yeah, so I don't miss anything, which I do.
You definitely will not miss that one. Obviously, since the legislation was finalized and we'd been obviously monitoring those bills as they move through the legislature this last session, and what the final outcome obviously created a lot of changes for us. Many of those go into effect July 25th of this month. So we have been reviewing the bills, having discussions here, and then also having discussion with the prosecutor's office, other agencies, the Washington Association of Sheriffs and Police Chiefs. And then obviously part of that was the Attorney General will be providing model policy and guidance, but that is not due until July of next year. So up until then, we're left to comply with the law, but we're not getting any guidance from the Attorney General. So that's why we've obviously have been having discussion with the prosecutor's office. one of the challenges and one of the changes was when it comes to use of force and the restrictions placed on law enforcement. And essentially we can use force when we have probable cause for arrest, to take somebody into custody, say on a warrant, to prevent somebody from escaping who's already been arrested on probable cause. And then the final is to protect ourselves, another citizen, or potentially a person trying to do harm to themselves. However, there has to be an imminent threat. And basically the definition of imminent that's come out of that is it has to be immediate. So unless we can articulate an immediate threat to take somebody in on an involuntary, we're not going to be, it'll essentially have to be a voluntary commitment. They'll, we'll offer to transport them to the crisis stabilization center or the hospital, as we've done on ITAs in the past. But if they're not willing to go, and a lot of times people that we take on involuntaries that are in mental health crisis, they don't want to go. And, sometimes that's just because, the state they're in, they don't, they're unsure of what's going on. And so it creates some challenges. So it's not uncommon to have to use, some level of force to take people into protective custody. And again, at this point, that's going to be under very limited situation where we can do that. So we've already run into it where the DCRs have issued a pickup order for us to go and pick somebody up, but those pickup orders may be 24 hours old. So to say that it's imminent danger for us after 24 hours, it's hard to say that that danger is immediate, since we've already gone a span of 24 hours or longer. So those are some of the things we're working through. And again, in our discussion with the prosecutor's office, they say as written, unless you have probable cause for a crime or there's an immediate threat, you can't use force in those situations to get somebody the help that they need. So there's going to be situations where we may have to walk away from people that are, suicidal or family members have concerns about their ongoing safety. And those are some of the safety concerns that obviously we've raised before. And those same things apply for other community caretaking functions, juvenile runaways, things like that don't want to go back home or go with us. So hopefully there'll be some updates and changes. There's just a lot of unintended consequences that come along with this. But I think involuntaries, especially for the Crisis Stabilization Center, we're going to have to get some more guidance from the AG's office and potentially some legislative changes to address those.
And so one of my questions is specific to that RCW 1031-110. It allows you to place somebody in lieu of arrest, meaning that you've already determined that a low-level crime has been committed, and that you believe there's a mental health influence to that crime. So is it a use of force then to transport them to the CSC instead of jail? If do offer that, or how does that work?
If we had probable cause, we could use, obviously necessary amount of force. And we've done that. We've been doing that for several years. We've had the opportunity to, listen, instead of arrest, we'd like you to go to the hospital or now the Crisis Stabilization Center, and then you can refer those to the prosecutor's office. And obviously that's the whole intent of the LEAD program. So that option would exist.
Okay. And I think that's really what we're looking at in the CSC, right? Is rather than arresting and taking to jail, their alternative is placement at the CSC. And as we've discussed before, if you need to physically manage them, obviously the CSC isn't going to be the place for them anyway. Yeah. Right. Okay.
And again, in a lot of those situations, I think more in line with the LEAD is rather than to actually take them, there'll probably be some kind of referral just because resource limitations. And I understand the crisis stabilization facility is, as expected, is, the population there is increasing and bed space is decreasing, and then other resources. So I think a lot of times that's just going to have to be by referral, and probably somebody would make contact with them the next day. And then obviously those reports would be forwarded on to the prosecutor's office as more of a referral.
All right, work in progress. Sounds like the new legislation doesn't totally mess it up, but messes a lot of things up. Stephen?
Thanks, Ann. Thank you, Doug. Can you give us some sense of what proportion of the use of the CSC so far, or in its earlier incarnation, was when there was probable cause for a crime and you were giving them that choice of going to jail or going to the hospital or the triage facility, versus the kind of situation that you're a little bit restricted in now by the new legislation? What proportion of those cases?
Well, prior to that, obviously we, I really can't give you any numbers, and the CSC for our folks is fairly new. So in those situations, it was probably more by a referral. They would just make the decision not to arrest and leave them at the scene, and then make a referral to refer that case to the prosecutor's office. So at this point, everything's been for the most part been a referral. I don't know the actual usage of the crisis stabilization, because obviously the substance use side was up and running before the mental health side of the facility.
We have had police drop-offs in this new facility, and I will get those numbers and make sure we report them at Monday's meeting. There is some use, but again, I think there's also, a lot of challenge on law enforcement right now in terms of how they manage all that. But I think getting the numbers to people will be helpful, because there have been some diversions. Okay. Other questions for Doug or issues about this? Why is I know this is a rhetorical question. Why does it take a year for the Attorney General to weigh in on legislation that is due to begin officially this month?
That's a good question.
Okay, that's what I thought. No. Not, yeah. Some right hand and left hand are not working together here.
I would agree with that statement.
Okay. All right. Anything else on 1310 here with the Crisis Stabilization Center? Good news is we're getting police drop-offs.
And like I said, I think Whatcom County is better situated than a lot of other counties to handle these changes, because we do have LEAD, we do have the Crisis Stabilization Facility, MCOT, and other resources that we've been working on standing up. So I know a lot of other counties are really scrambling because they're mandated to divert, but there's no resources for them to divert to.
What's MCOT?
Mobile Crisis Outreach Team.
I'm still learning acronyms after 6 years.
You will not be tested, because we also change them from time to time.
Well, that's our next agenda item, isn't it?
Yes, it is. So good segue. So I'm going to read to you a email I got from Sat Paul, which said he was sending it to a few of us, Erica, Tyler, Schroeder, and me. Can you guys come up with a simple name for the facility, the Crisis Stabilization Facility? We can honor some past personality or one from our local region. And so I thought, let me bring this up first to this group here. And the Crisis Stabilization Center is a lot of words, a lot of syllables. Those of us who are using it a lot in our language either talk about the center or the CSC. If we were to name it, do people have thoughts about that? Yeah.
Was Satpal suggesting naming it after a person?
Well, yes, which was kind of interesting. So we can honor some past personality or one from our local region. That's what he said. I haven't talked with him any further about it. So what you're smiling there, Doug?
I'm sure I can come up with something creative, but not on the spot.
So I'll plant the seed now. We could make it something really simple. I just don't want it to be corny. You could call it the Hope Center or something. I don't really want to call it the Recovery Center because that's used more for substance use, and we are getting ready to open a recovery house. So that would be too confusing for the community. But something to think about.
And maybe we could just put it out to the task force and ask people to send ideas to you, because this seems like the kind of thing that would benefit from brainstorming. And I mean, I'd come up with some real funny names that make you all laugh, but I don't have the right name right now. And I think I'm not a super fan of people. I think picking something that would sound good in 40 or 60 years makes more sense. Unless it's a person that we don't have to worry down the road there's a question about whether we should have named it after them, and I'm just not, but I think the idea of saying, hey, this is a possibility and perhaps there's a better name, and why don't you send them in to Anne, and then we can revisit it in a few months and see what we come up with.
Great. We can have a contest.
The winner gets 2 nights.
Yeah. Which reminds me, I didn't have this on the agenda, but I think I talked about it. We have a mural project underway where, because of the safety issues in this facility, the actual treatment units can't have regular artwork on the wall that has frames and things that people might be able to take off the wall and use in ways that aren't normal for artwork. And so we actually have makeshift volunteering to organize and facilitate the painting of murals. And so we have 5 different locations that have been identified for these murals. They'll be kind of landscapes. They are currently working on a fundraising project. The county is giving them 10,000 seed money. I think they think it's about a $20,000 project to make sure that we pay the artists, and just some lovely pictures, and it will help liven up the place and make it look nice. So that's pretty cool. So I also wanted to talk about the old triage space utilization. So
Ann?
yes, I'm sorry, Stephen.
That's okay. Before you leave that, do you know where we stand on the fundraising for the murals?
It was very, very small, like less than 1,000 a couple weeks ago. And I told them that the county could give them 10,000 up front, in part to help cover the administrative costs and things like transaction fees that the bank cards charge, and paint supplies. And that leaves a little bit left over for stipends for the artists, but not completely. But they thought if there was some seed money that might help. And then I think they are working on some communications to get the word out more broadly. Okay. So the other issue I had to ask about, so before we opened this center, we were using the old place, which was at the end of the jail work center. And it currently has, some offices for staff in a general lobby area. And then the treatment unit piece has 4 rooms, 3 single and 1 double room that are actually rooms, and then 3 bays, meaning that you could put a number of beds in there or something. And so the question has come up, how do we want to use this new old facility? So right now we've got the mobile crisis outreach team and the designated crisis responders using that, but they will not be there forever. They're going to be moving. And so in talking with the county executive, I think he was interested in using this for like purposes, meaning some kind of behavioral health, you know, whether it's crisis services or outreach services. And I just wanted to throw that out. Obviously, it can be used as is for, you know, 24/7 residential type of services. It can just as easily be remodeled into more like office space or something, but thought I would throw that out. Doug?
I don't want to, I think Jack had his hand up first, but
Oh,
I'll go ahead.
I'm sorry.
I don't know if it's appropriate to have it that close, but I'd like to see something similar to the CSC there, specifically for youth. I think when it comes to behavioral health, homeless shelters, everything else, you know, everything seems to be geared to adults, and the youth here in Whatcom County seem to be an afterthought. So, and is it 18 and older at the CSC? Is that correct?
That's right.
So some kind of, whether it's a dual mental health, substance use place for youth, I think would be beneficial, because I think there's a lack of resources. I just don't know, and you would know better, and having them that close to an adult facility, but that's would be my recommendation for that space. Because again, we're seeing a lot more kids at a younger age having significant behavioral health issues.
So Michael, I'm going to have you put that in your hat to think about. We have heard that. I think for us, it's been a matter of funding it. It's always operations, right? You can't put quite as many youth together. Although we could, right now, that space or previously was serving 13 people. So it's possible. Finding an operator and making sure we could fully fund it would be critical. But we have heard that, and that's a great suggestion.
And I would assume for meals and things like that, they could utilize the kitchen across the way at the CSC.
Right. And the kitchen at the CSC is also going to be providing meals to the new recovery house as well. So they can serve a lot of meals out of that kitchen. Yeah. Jack?
Doug, the problem with your ideas is too practical.
This is government, right?
I know, I did like it. It's not where I was going, but I think that's one of many great ideas, and I would really support that one. But what I wanted to suggest is there seems to be a bit of a synergy going on with that whole area. I hesitate to call it a campus with the work release, the jail facility, the crisis stabilization center, but I can see a synergy with county resources relating to both criminal justice and mental health in that area. And I would tend in the short term to defer to council and county executive to maybe see how much they want to use that space and in what ways, because there may be a natural need for that space that will emerge with some planning, or it may be that we just have what we have there and nothing changes. But I can easily see some more use in that area. And so I think I guess what I would suggest is what we recommend for that space now, I would tend to defer unless council and executive decide if they want to do more in that area right now. And if they don't, that's fine. If they do, then there may be a natural use for that space. Because I am of the belief that there may be some possibilities out there still that are not in place.
Do you have ideas about that? The exec's office has deferred to us. So my only worry is once we get the opportunity to have the space and use it, if I give it back.
No, I don't want to do that. I'm actually seeing the exec tonight. So maybe I'll ask, do you guys have plans? I mean, we have, as we look at what will happen long-term. So I'll go back to the thing this task force is trying not to talk about from the beginning, and that's the jail. The reality is that downtown jail is pathetic and needs to go away. The question is, what happens with it? How is it replaced? And I actually believe the decision of what to do out in that area out in Iron Gate could factor into that thinking. I'm not sure that it would or wouldn't, but as a community, we have to figure out what are we doing with that downtown jail. And I mean, all I can see is to knock the thing down. Others may believe that it can be repaired. I don't know, but I think that decision informs other decisions, particularly relating up to Iron Gate. So for example, the downtown facility is a maximum security facility, basically. What if the maximum security facility is smaller and there needs to be expansion of medium or restricted medium, or even a work release that basically has a fence but not a lockup function? I mean, I just think we don't know where we're headed. And the reality is we have not resolved the issue of the jail at all. And it needs to be resolved. So I think using this short term for something is fine, but I can imagine several scenarios where that space becomes useful in ways that relate to a new jail. I just don't know, and I don't know where the exec or the council is on a new jail. And I'm not trying to get this committee overly involved in that, but I think it informs our thinking on it.
Other thoughts? Todd, I'm looking at you.
It's kind of complicated. The Jack's brought up some stuff that I think is relevant. So maybe this depends on we're talking about a short-term use or a long-term use for that space. But I think the executive does have interest in expanding county operations in that area, just to put it generally. And not all this is public. So that's maybe a conversation to have with the executive in terms of long term. But yeah, we're having very kind of tangential discussions about what might happen with the new jail facility, and it kind of comes to that area sometimes, that those discussions do. So, but I don't know if that really constrains what could be done with this space we're talking about right now. But there's the potential that there's going to be more stuff locating out in that area. I remember when we first started talking about this, before the center was even built, there was the idea that it would be, it would give us more capacity for what we're doing with this center. So I don't want to. I mean, if Andy, your worry is like we lose it if we don't find a purpose for it, I'd hate to see that. There was also discussion, I'm going back a couple of years, that if part of the discussion about the jail was going to be repurposing the work center, because this is physically attached to the work center building, right?
Yes.
If that's going to be part of the long-term jail solution, that then this space might be in play for that. I remember that a couple of years ago. So I haven't really given much thought to it, but I'd hate to see it lost. I like Doug's idea, or something, where it's continuing the mission that it's had.
Thanks. Jack?
Yeah, there's been talk about this space for a long time. And I mean, I've been around since we built it, and it was going to be temporary and go to a business. And I was like, hey, I'd like to line it up for my business. And I'm not surprised it never went to business. But it's hard for me to imagine, with the pressures we have on our criminal justice system, that portion of the building, given that it's attached to what it's attached to, doesn't have a logical use that would relate to a jail or relate to that kind of thing. So that's the only point I'm trying to make. And I apologize if I've walked into anything else. It's just that area has been in discussion for a long time, and that building in particular. And it just seems logical, if we're trying not to have a mega jail, which the voters have rejected, that using that long term in some kind of capacity already attached to a building that is a jail could end up being the logical thing. And that's the point I'm trying to make. So if we make a long-term commitment to something else, that may not be wise. And but I also strongly agree, hang on to it, short-term, do whatever. But those are, I do have thoughts about that building and how, I mean, I would have bet 2-1 when the building was built, it wasn't going to go to business, but I tried. I tried to see if it did, and it simply didn't. And I doubt that it ever will. And I think it's actually performed pretty well. It's certainly if I were incarcerated, I'd rather be there than at 311 grand. So thanks.
All right, Doug?
Just to add on to what Jack was saying, obviously during the pandemic, we had to look at alternatives, and we had to move some population over there, and some security concerns about who we moved, just because it's not built as it is built as a minimum security. So anything done to that building, and we contemplated what could we do to make it a little more secure if we had to shift that population. So those conversations have been had, but it was always intended to be a temporary facility, and it was built so that it could be turned back to industrial. Somebody could buy it as more of a warehouse that has big bay doors and things like that. So that was always the intent, but we certainly need to get out of the downtown jail, and whether we remodel that or what happens. So I understand it makes sense to, if we're going to be there, to add on to that. But I also think there's a need right now for behavioral health services, specifically for youth.
Very interesting discussion. I didn't really see it going this way. And so I think I think it's probably worth a conversation. Doug, it seems to me that, we've always kind of dedicated that end of the work center to criminal justice diversion by way of behavioral health treatment. And I think we probably should discuss it in a bigger picture, and in context with some of the other things being discussed about that whole Iron Gate area and how it might be used. So yeah, a lot of moving parts. I think for us, certainly right now, behavioral health is paying for that space. So I just don't want to pay for something that isn't behavioral health. But that will be my issue. Okay. So that was really what I had on the agenda today. The detox side of the house has been running pretty much full, 15, kind of averaging 15 a night for 16 beds. So that's quite a bit. The mental health side is still at capacity at 10, hasn't yet moved up to 16, in part because of some camera issues and other things, but that is still in the plan. And they are hiring more people, which was the other issue. And of course, as we talked before, workforce shortages have been really challenging in terms of getting these programs fully staffed. So that will be what we'll continue to work on, is expanding to 16 beds in the mental health stabilization side of the house. It's still certified as voluntary treatment, which doesn't seem to be a problem right now, given all of the issues with 1310, and that right now it sounds like police can and law enforcement can encourage somebody to go there instead of jail, which would be more of a voluntary type situation, with perhaps consequences if they change their mind midstream. So any other questions or business for the good of the order today? Jack and Stephen, I am out of town on Monday when we meet. Don't know if there is, I'll work maybe with my staff, or if one of you want to give the report of today, or Jill, if you want to, what's the wish?
Stephen will be gone, and I think I can
Okay.
do it. I'm just going to say we had a really great report from, I don't know your official, is it under sheriff?
Under sheriff.
Okay. I knew it wasn't under sergeant, and being former military, I don't want to get these wrong. You had to do push-ups for that. So under Sheriff Chadwick. And so I'll explain, we had that that update, which was great. And then we had a very brief discussion about the old facility, and I would say there was consensus that we believe it should be used for behavioral health, with the understanding that down the road it may have another purpose. It just, time will tell. And I don't know. Oh, and that we're going to get updated information on the utilization. But I think, while some people really want the data, and so do I, about law enforcement drop-offs and how the Crisis Stabilization Center is helping diversion, the reality is, because of COVID and because of getting up and running and because both sides aren't there, we haven't had a chance yet to let the system really work. I mean, we're using the system, and that's great, but I don't think any of our numbers will reflect our potential yet. At least that's my perspective.
It is absolutely true. I mean, we are certainly working with Grace and Lead on a regular basis. We do have a Crisis Stabilization Center Program Advisory Committee that really is looking at program issues, especially referral and admissions, and working a lot with both the Sheriff's Office and BPD in particular about that, and EMS as well. I think Grace program already has community paramedics and law enforcement that can take folks there and refer them. So they're working very closely with them. But you're right. We are definitely in flux given the challenges.
I'll explain it that way. I think it's a fair explanation. So if that all sounds good, that's about what I'll say, and I'll just defer questions to you in writing unless it's something obvious. And yeah, I think that would suffice.
All right, great. Okay, anything else for the good of the order? Public comment, is there any public joining us today, Jill?
We have today with us Jackie Mitchell. Jackie, if you want to speak, go ahead and raise your hand now.
That hardly counts as public.
Come on, Jackie, we want to hear your voice.
The opportunity anyway. No hands raised.
All right. Well, I will let us leave early, which is a great thing for us all. Appreciate it. The only other thing I would say is that if you haven't seen the pictures of the facility on the website, I would definitely go there. And it is in the Health Department, Human Services, under Crisis Stabilization Center. But there's some great pictures. And I don't remember, Jill, I'm sorry. I did a PowerPoint for the Medical Society, actually, that had a lot of great pictures in it. And I can't remember if I shared it or not at the last main meeting of the Incarceration Task Force.
You did share it with a full task force, and I'd have to go back and look at the notes to see exactly which one. It might have been the one before, but I'd have to check my notes.
Okay. I just want people to see how cool it is if they haven't. So sounds like we've shared some pictures, but if people are looking, I've been asked by some people, what about tours? The problem is we opened this in January when hardly anyone had received vaccinations and obviously didn't have a grand opening. And I think that's pretty sad. And in fact, we heard from the Medical Society that many people didn't even know this existed. So I'm disappointed on our part that we didn't do a better job of some kind of a grand opening without a grand opening. I know it's challenging in this world. So we may think about doing something a little bit more formal. I'll talk with the exec's office about that. But having tours now when we have people using the facility and trying to protect the privacy of the guests there is obviously challenging. And, having an elected official walk through and see their next door neighbor in there, for instance, could be problematic. All right. Thank you for your time. Have a great afternoon. and take care.
Thanks, Ann, and